Good day, this is Dr. Koumanis here at Capital Area Plastic Surgery. I'm a board-certified plastic surgeon here in upstate New York in the Saratoga and Glens Falls area. Today, our topic is going to be skin cancer. Now, it is important to talk about skin cancer because skin cancer, malignant skin cancer such as squamous cell cancer or basal cell cancer, and especially melanoma are on the rise in the world. And it's important for us to talk about how to treat it, but also about prevention. The first topic we're going to discuss is prevention. How do we prevent skin cancer? Well, the most logical thing is to avoid the sun. However, this is what I tell my patients. Vitamin D comes from the sun, and vitamin D is quite important for the health of skin, bones, and to boost and strengthen our immune system. And therefore, I tell them, so go out in the sun, get some vitamin D, but don't stay out enough that you're going to burn, or that's right before your burning point is. And everybody's is different depending on if you have light, fair skin, or if you have dark skin. You need to apply skin lotion with SPF factor. So you want to apply sunscreen often, especially during the hot hours of the day. You want to avoid the sun during the hot hours of the day, which is the early afternoon. But when you're out during that time, you want to put on skin sunscreen with an SPF factor of 30 or greater. You want to reapply when you come in and out of the pool or if you get wet, even if it's waterproof, and apply every so often. Also, when there is excessive sweating during sports events or just sitting out in the hot sun, you want to reapply as well. Another thing that we can do is avoid excessive sun tanning in sun tanning beds, or avoid them altogether. They actually produce harmful UV rays, which increase your chance of getting skin cancer. The next topic, which I always get asked, is self-examination. What are the rules? How often should we self-examine ourselves for suspicious skin cancers? In the next topic, we're going to talk about diagnosis and what to look for, but how often do we have to do it? There is no consensus through the medical body and the World Health Association on how often you should screen. I screen my patients approximately once a year, especially if they have skin cancer. If they've had a history of melanoma, it's more often throughout the year, sometimes 3 times a year. However, you should be checking your body in the mirror and when you come out of the shower regularly for suspicious moles or suspicious growth. Now we're going to discuss the diagnosis, signs, and symptoms of malignant skin cancers. There are 3 types of skin cancers that we normally see in our office, and that is basal cell carcinoma or cancer, squamous cell cancer or squamous cell carcinoma, and melanoma. Squamous cell carcinoma and basal cell carcinoma are less malignant than melanoma, and so we will discuss these in 2 separate categories. Basal cell carcinoma and squamous cell carcinoma can come in sizes as little as 3 or 4 millimeters, and they usually look red or brown, and if scratched, they bleed and will not usually heal. The skin growth will come back. It can be as much larger as well. When looking for signs and symptoms of melanoma, we use the acronym ABCDE. And the A stands for asymmetry. A melanoma is usually not perfectly round or square or rectangular, but more irregular in shape. And then the B is borders. The borders are asymmetric and they are irregular, which goes hand in hand with the asymmetry part of the acronym. C means color, non-uniform color or color asymmetry, meaning that the lesion or growth of the melanoma will have different colors in it, and they're usually dark brown, black, purples, even some reddish tints. The next letter is D in the acronym, which stands for diameter. Diameter of a melanoma, which is malignant, is usually greater than 6 millimeters. That means that has to be larger than that usually for it to be malignant. Now that isn't always the case, but it is a pretty hard, fast rule that if it is greater than 6 millimeters, then you worry about melanoma. When my patients come to the clinic, we screen them by gross examination. Because of my large experience of dealing with skin cancers, I can usually tell by gross examination what kind of skin cancer it is, but not always. If there is a need for a diagnosis to be more ideal, then we take a biopsy. The biopsy is usually taken with a punch biopsy, which is a 2 to 3 millimeter punch mechanism that we do under sterile procedures with a little bit of local and with very little to no discomfort to the patient. That is taken, put in a glass of formalin or formaldehyde, as they used to call it, and sent to the pathologist so that they can look at it under the microscope. Under the microscope, they will be able to tell us what kind of skin cancer it is and whether it has certain characteristics, for instance, mitotic figures, meaning is it rapidly dividing or not. For the melanoma, they stain it with a special stain called S100 and a few other stains, and then they can tell if it's a melanoma or not. And they also tell us what depth it is. The depth of the melanoma is important because it basically will steer us towards what kind of treatment and the amount of skin tissue that we need to take, which we'll discuss in the next section. I also look for lymph node status, which is done by just examining the lymph nodes. It's more common to have lymph node involvement in melanoma than it is in basal cell and squamous cell carcinoma. Basal cell and squamous cell carcinoma is not usually fatal. Melanoma is much more serious and needs to be treated much more aggressively.